Thank you everyone for joining us for the Money on My Mind panel. As Hallie mentioned, we're going to be discussing the growth of digital health funding and its future. And we're honored here today with Jim from Mayo Clinic Ventures and Jack Young from Qualcomm Life. So to start us off, why don't you guys tell us a little bit about your fund and your current investment thesis?
Sure. So I'm Jim Rogers. I am the chair at Mayo Clinic Ventures. Mayo Clinic Ventures has both the technology transfer arm for Mayo, but also the venture investing arm for Mayo. We look at all kinds of technologies. So we're not just digital health. We're devices, biopharma, software, you name it. We have a lot of seed funds that we use. So we try to be pretty creative in how we get technologies to market. We look at both great technologies coming out of Mayo and trying to find great technologies and pull them into Mayo and maybe have a situation where Mayo can do a value add. We use entrepreneurs in residence. We use licensing approaches. We really want to try to find the best way to get people connected with the technologies. We tend to like to have professional management teams partnered with our physician teams. Our venture group has a different kind of approach. We're not a pure venture group from the standpoint that we don't lead investments. We're only a co-investor, and there has to be some sort of Mayo value add. And there, because we're so broad in terms of what we're looking at, our thesis is pretty much, can we find something that we think is going to be good for patients, and if we think we can help with our investment and see a return to Mayo in light of that investment, that's something that we're likely to invest in.
Fantastic. Thanks, Jim. I'm with Qualcomm Ventures. Qualcomm Ventures being around for 14 years. We have $850 million of venture capital money under management, all coming from Qualcomm. So 2011, we launched an effort. We see an opportunity in digital health. So we formed a fund called Qualcomm Life Fund, hence, the $100 million dedicated fund. I would say we are one of the few funds out there dedicated to this community. I'm very happy to report we actually been making investment in this area since 2007. And since then, we have now amassed 17 investments, what I call the digital health portfolios. 12 of them are in the United States and 5 internationally. So not only are we seeing proliferations in the United States, saw the opportunity to starting this company, but internationally now we have company in India, we have company in China, we have 2 companies in Europe and 1 company in Israel. So we have the world covered.
Great. So as you guys know, healthcare is something that touches every individual in some way, shape, or form. So what about digital health gets you personally the most excited, and how has digital health impacted you on a daily basis?
Well, from my perspective, where it can get exciting, there's a few things. One, it's not necessarily going to be heavily regulated, so it might be something that you can get to a patient quickly. I think another place where it's exciting from our perspective is it has the potential to take a lot of cost out of the system. It has the potential to make our physicians much more productive and efficient, and it has the ability to enhance the engagement our patients have with our physicians. It also has the potential to go the exact opposite way. It has the potential of feeding too much information and those sorts of things. But I think the potential is there, and I think it's fantastic from that perspective. I think the closest thing from a digital health standpoint is if you look at me, and if you can look closely, you can see that I need to lose a little bit of weight. And so I've been using, I tried a tracker. I'm one of those guys that are kind of I'll try it and then I'm non-compliant after a while. So someone actually, they gave me one of the trackers. I thought it was great. And then I was in the polar vortex snow blowing in around the February timeframe in Minnesota. And it disappeared. I think it went through the snowblower, I'm not sure. And I just didn't.
That's how the wearable company makes numbers, because all the devices are lost in the washing machine.
That's right. But I just didn't have I couldn't get past the activation energy to go get another one. But I like the concept.
It's drop some hints.
I like the concept. I think it's great. From my perspective, I think there's some real potential to change how people interact on their healthcare and how they take control of their healthcare.
Fantastic. Well, that's fantastic experience. So let me take this to a slightly different angle. The way we looked at it is actually digital health is actually evolving, right? The first thing people talk about in digital health is applications and devices and sensors, right? So think about what that is. Basically, otherwise you have to go to a hospital, take a measurement. For example, my heart rate, my ECGs, my blood pressure. And now you can do that constantly. You can do it at home, at whatever, right? So that's the first thing that happens, is what we call is mobilize the data, right? So everything gets mobilized. And then you say, well, off that, is any use, right? The use is actually coming to the second and third stages. What I see is the first thing is basically get the data moved to the cloud. The The second stage is that you combine that cloud with other information that you already have. For example, healthcare system, they have EMR data. It's been sitting there for a while. Even been sitting there longer is the claims data. Now you have a dimension of these real-time data come in, right? So you can combine these three streams data together. And maybe the other streams data, for example, genomics data is coming out. So there's an opportunity to combine all this data. And you know what? We have a very powerful big data analytics companies out there, right? So we can repurpose that and yield deep health insights. So once you have the insights, what happens is all these are meaningless unless it can cause a change, right? I sound like Obama right now, change. But the point is not only change the individual level, which means we're going to lose some weight, we'll be more healthy, but also change how doctor behaves. Instead of saying, I'm going to do a round robin, call everybody, I'm going to call my high risk because I know, combined with that, right? I'm going to change the healthcare system. The payer is going to look at the population management. How am I going to incentivize for big good behaviors? So the point is, if you follow my logic, it goes these stages, right? Get the data mobilized, get the data analyzed, and finally get data incentivized. So unless you can close that loop, once you close that loop, you see a momentum going, right? So hence the point that if I lose my Fitbit, if I'm using my insurance company is actually giving me $50 every month for me to maintain 10,000 steps. Maybe there's an incentive to buy another one.
Yeah, then I'd get over the activation energy.
So you mentioned getting that data into the system first. So do you imagine the patient-generated data coming from like consumer wearables, or do you think there's going to be more medical device flowing downstream?
You know, I think at least initially, I think physicians they're not going to be too crazy about the information coming off of wearables. I think there will be some, and I probably offended somebody, but I think at least early on, one of the questions is, for example, what are the algorithms that you're using to track? So are the algorithms even valid? And if they are valid, then what kind of information are you getting? And then it's a question of, is that information really helpful from a clinical decision-making standpoint? And then separate and apart from that is, how do you store all that data? What data has to go into your EMR and all those sorts of things? So I think that's calling a lot of questions, I think, at least initially. Ultimately, it's probably where the future is. I think, but at least initially, in my mind, it's more going to be coming from the device side than from the consumer side.
Yeah, well, that's there's no doubt it's going to happen. It's going to happen at certain paces. So if lots of us actually work in IT. So when I look at the HIT, it's looked like IT 5 years later, right? So what happened is, if you look at it, what I just talked about, these wearable devices or medical devices, is basically analogous to your Twitters and Facebook posting, right? So in the past, if I'm at Coca-Cola, I know your age and gender, maybe you live in the suburbs. But today I know actually you visit certain sites in real time. So I can grab you to sell you the Coca-Cola. The point here is that going forward, today the doctors all the last visit, last EMR, last claim. But in the future, the doctor will know whether voluntarily, involuntarily you contribute that. Because what you said in the healthcare, in the communities, or the devices that you're wearing, that the doctor just have another dimension. So the point is not when, it's going to come, because if I look at the history as a reference, we'll see these data is going to move into the healthcare and become native for the healthcare systems.
So we're going to change gears for a moment. So we have a lot of aspiring entrepreneurs in the audience. So hoping to get the inside scoop from two of the most active digital health investors. You guys are obviously most well known for your hits, but I'm sure everyone wants to hear about the one that got away. So which company did you pass up on that you regret?
Well, I wouldn't call it passed on, and sometimes with all the well-intentioned, right? There's only two of us in the fund. Lucian, by the way, my colleague standing in the back. There's only two of us, so there's only 24 hours a day, and some people think I'm goofing around, traveling around, but I've been working all the time. But the point is, actually, we do have, there's a fine amount of capital each company can absorb, right? So even though I may miss some company, case in point, for example, one of my company, Fitbit, we actually invested in last year, but we know the company for many, many years, and unfortunately, just one thing leads to another. We couldn't get in. So any companies out there, you stay in my database. I'm going to be calling on you until you go IPO. Don't worry.
I think for me, I probably don't know the one that got away. And the struggle for me, and I'd love to hear your thoughts at some point, folks, is just trying to figure out a way to triage the ideas that are out there, to get them to a point where our engagement can be useful for them, and they can be useful for us. It's just like drinking from a fire hose, and we're across all these different sectors and technologies, and we're trying to find, areas where our physicians can be more efficient, or areas where it can really significantly improve patient care. But I don't know how to triage it. And so it really kind of gets down to almost a reactive mode and a kind of case by case. And so my guess is there's some great ideas out there that we've let go by that I wish I would have been part of.
So I guess I should hit up Jim afterwards and submit your ideas to him.
More importantly, hit me up with a triage function is what I really want.
So if these entrepreneurs and companies want to be your next investment, what are the top 3 things they can do to have a successful pitch? And what ideas and metrics do you guys get the most excited about?
Sure. So here's the phenomenon I have observed, and I said in the past, if you look at it, I mentioned earlier, the HIT basically is a couple years behind. So for entrepreneurs, especially come from IT or even from a medical perspective, that you see obvious things has not been taken care of or has not been upgraded in a hospital, right? The problem with that is it's these ideas out there. Everybody is aware of that. And my biggest agony is I've seen these things pop up everywhere in the country, 4 corners of the country, right? So everywhere is starting these companies, and unfortunately, venture capitalists is such a chaotic scene, as you probably know. That's why you have to talk to 50 investors before you get a funding. The problem is we have a limited information, and we have a tendencies to focus on the area that we are comfortable with. So hence you see these competing ideas popping up everywhere. By the way, this is how capitalism works, right? But unfortunately, that's what happens. So the ideas are popping up everywhere, so talent get diluted, market get confused. So how do you break that? It's actually very difficult, especially now. I kind of say it, and I think the digital health has reached its midpoint, because after 3-4 years growth, we have reached the peak. So everybody now is going to be looking for evidence, right? In the early day, you go, I got this wearable. It's so cool. You should invest in me. Today, you won't get that, right? You're going to come and say, well, how many you sell? What's your traction? So for us, I think it's most important is to see the traction you have it demonstrated. And hopefully, you can even demonstrate some economic values. The hospitals are validated, there's ROIs. And finally, I think what happens is capital matters, right? So there are a few established investment teams out there, especially the investor teams has a big capitals, ourselves, named a few others, and Sand Hill Road. So if you can get their attention, pull the capital behind you. That's the key, right? Because idea is not the number one important things. Because if you have an idea, somebody's copy it. Think about Doctor on Demand. They got $90 billion. $90 million? Why $90 billion? So how are you going to compete with that? Podius, they got, $300 million. How are you going to compete that? So you're going to find the ways somewhere else and find a way to get the capital aligned with you, and then you have a shot.
And we're a little different just because of the way we do our investments, again, with having to be not a lead, but a co-investor, and also having that Mayo strategic ad. For us, it's about relationships, and what's most important is that you have physicians who are willing to put in the time to be part of either the validation studies or be part of the collaboration that it'll take to bring it on through at Mayo. And remember, most of those physicians are being asked to do more and more and more in terms of seeing more patients, seeing more patients, seeing more patients. And it's a little bit challenging for them then to say, hey, there's a great idea. I know it's a startup. I know it's not quite proven yet, but I really think you should take a look at it and spend a lot of time on it and help us try to validate it before we're willing to invest in it. So you just have to think about it in that kind of context, who your ultimate client is, if you will.
Have you guys been seeing more innovative business models or suggestions from the startups to how you guys can work together?
If I have to think about it, then the answer is no.
So no new monetization revenue streams that.
So what I would say is I kind of keep on looking what happens. So again, I have a benefit working Qualcomm Ventures, so my colleagues invest in IT, right? I've seen lots of things happening. So let's just take an example. In the past, if you're working on an application, the freemium model works to some degrees. If you want it, I'm happy to. Should I explain a little bit on the freemium model? So, okay, so why the freemium model work or may not work? So it's very simple. So most of the entrepreneurs come to me and says, hey, I got a free application. It's free, right? By the way, it's free for me as a user to download, but it's not free for you as an entrepreneur. To download the application, statistics say CPI is cost per download. It costs you $2, right? So in other words, if I give you 100 copies away, free download costs you $200. Maybe there's a way you can do some kind of a social marketing, bring down to $1.50. But let's just take $1.50, for example. 100 copy goes out the door, $150, right? So you're hoping to get a conversion free to premium. 5%, I'll tell you, this is by far the top end, right? So if you come to me, you say you're going to 5%, I'll tell you, how much can you charge? Maybe $10, maybe 3 months, people are going to drop out. So if you do the calculation, it just tells you, costs you $150 to get 100 people, and you get 5 people to pay you $30 for the lifetime. So hence, it's a wash, right? So that business model obviously is being challenged. That's why I think most of the application company has not hit the marks. So if I were looking what happened to the IT side, this is what's happening, right? So I think the health applications that are coming out try to make that model work. It's very difficult. So you maybe have to try other things. I'm not suggesting there's a model out there, but if you look at the gaming company, realize that kind of dynamics no longer working. So what it basically said, forget about the freemium model. It's just going to be free. Let's making money other ways, just like the singers today. You cannot sell CDs anymore. They're running concerts, right? So if you look at the Angry Birds, how they're making money, they're not making money for selling games. They're merchandising it, right? So you're going to be finding other ways to making money. Unfortunately, just follow that business model. It's not going to work.
Yeah, I don't know if I have anything to add to that.
So obviously you guys are investors in the digital health space, but you guys are part of a small long tail. So a very few investors that are in this space. So this is kind of like a two-part question. Why do you guys think investors are hesitant to get into this space? And the second question is, why do you think they should be investing in this space?
Well, I'll take just a quick shot at that. I think I look at it just from a business standpoint first. So without talking about whether I'm investing or not, I think, again, it's always a challenge if I'm going to say to someone, to a division chair, this is an idea that I think is going to work for you, you should bring it on. And then they're thinking, well, who's behind it? How substantial is it? People are used to dealing with device companies. They're used to dealing with biopharma. Digital health is a little different. It seems like it's a little more virtual. It seems like there's not as much there. And it's generational too, depending on who you're talking to. Like earlier we saw, I think younger people are much more willing to adopt different things. I was not one that put up my hand with artificial intelligence being the one that was going to be my physician. I'd want a physician. My kids would probably be okay with artificial intelligence being their physician. So I think there's some of that probably going on. And then what was the second part of your question?
Why should they be investing in digital?
Well, I do think that there's a ton of disruption that's possibly coming here. It's moving quickly. There's a lot of really smart people in it. It's exciting. And I do think it has the potential to really change the way we engage with our patients and the way patients engage with us. And I think that's important. So I think if people start to see that kind of track record, they'll follow along.
Well, I was going to say, I don't see there's any hesitation to invest in the space in general. Individual company may experiencing some resistance, but I have to tell you, the number shows, right? Overall, the number is going up. And if you look at it, more and more companies are jumping into the space. So if you look at, certainly we have been repeated investors, but you're going to find out more and more company are building that kind of portfolio. So the question is, why should we invest in digital health? I mentioned it many times that it's lagging behind factor, but others, if you look at it, I'm sure you heard about the $3 trillion numbers, but it's the second single largest expenditure beside the housing, right? So certainly that dollar, it's going to be moving from mostly, this kind of the current system to shift into a more digital-oriented economy. So I think there's a tremendous opportunity to invest in this area, and it's going to continue because that dollar is already allocated, right? It's just a matter of shifting.
Jim, earlier you mentioned you help translate kind of in-house technologies into commercial businesses. So how do you guys inspire and support these entrepreneurs to start these companies, and what are some of the challenges they faced in translating the sciences?
We try all kinds of different approaches. We like to be as flexible as we possibly can. So we'll work with established entrepreneurs. We're invested with Rock Health. We work with Group Sound, all across the country. We try to figure out what makes the most sense. And some ideas are longer-term bets, and you can look at an accelerator that way. Some ideas are very early on or very late on, and you can license them right away. We try to be as encouraging as possible. I try to bring interns in. I like to bring and expose my people to as much of what's going on here as possible, because I think it's important for them to see kind of where things are going, what the reality is, where the possibilities are. Open invitation. You want to come out to Rochester, let me know. Happy to show you around. We do have a kind of a small accelerator. It's nothing of the scale or, frankly, the class of a Rock Health, but it is a way for us to be able to kind of get some local presence, have an ability with people to have space, have the ability to talk back and forth, share ideas, and really start to build kind of an ecosystem in Rochester, Minnesota.
Jack, this is a question for you. So what do you envision the future of a hospital to look like in 20 years, and what technologies do you imagine in place?
That's actually an interesting question. So I'm going to borrow Eric Topol's lines is, the future of the hospital is no hospital beds, right? So his idea is, if you look at it, you think the Four Seasons next door expensive, try to calculate how much you're going to spend on a hospital bed per night. It's staggering, right? In thousands of dollars. And also, where hospitals are killing the hospital infections and all the procedures, I read it somewhere, it's like crashing 50, I would say, 747s every year. That's how many people dies because the hospital, because staying in the hospital. So that number is staggering. One, it's expensive. Secondly, it's dangerous. So why would people want to stay in the hospital, right? So the future of the hospital, I think it's going to be moving to the continuous fashions. And the other thing I was going to point it out is that everybody knows that reverse pyramid, right? So meaning the 5% of the population spend 45% of the healthcare costs, and those majority, the expenditure is spending within the hospital. Is a way we can push the population to be more healthier, hence you never get into the 5%, chronic ill, multi-chronic. And that's the future. I don't see us building gigantic hospitals. I see a faster response time. I see people doing that more prevention than sick care.
Jim, you're obviously closer to the provider and clinical setting. What are your thoughts on the future of what a hospital will look like?
Well, I do think there's going to be a push to try to keep people out of hospitals. I think there'll be a push to try to engage with people earlier and to try to do more well care and more prevention. There's no question. I think there's always going to be a room for hospitals. You're always going to have the bricks and mortar there. And the other thing about healthcare is, for whatever reason, it just doesn't move as quickly as some of the other industries. So as much as a lot of us would like it to speed up, we have to also understand the nature of the beast that we're dealing with. There's a lot of external change right now that are causing changes, and they're causing change at a fairly rapid pace. But it's still pretty slow when you compare it to some of the other industries that have gone through these types of transformations.
Are there any specific types of technologies or companies that you think would facilitate that shift? Any ideas you're hoping to see that aren't out there today?
Yeah. I was going to say, actually, the most interesting thing that's happening is, if you look at it again, the funding report everybody is working on. So as you know, healthcare is 4 Ps, right? You got the patient, provider, payers, and the farmers. So if the majority of the dollar actually being spending on the first 3 Ps, patients get educated, more aware, right? They know how to pick. They bring more information to the providers. Providers get EMRs. And look at the payers, obviously, they do all the data mining, population management. But if you look at the farmers, really, it's still the pill you seen yesterday. They give you a pill, and hopefully you'll refill it automatically. If you have a symptom, maybe they'll take care of it, end up in late-night lawsuits, right? So I think that the biggest thing that we're going to see that really hasn't really come in yet, but I think it's going to come in a big wave, is the farmer is going to take advantage of all the investment we're making, hence to push the ecosystem even further.
I'm excited across the board. The things that are going on in robotic surgery, and there was some questions about the ROI on robotic surgery. It's going to get there. Ultimately, there's an advantage to having robots in the surgical suite, but it doesn't mean it's going to replace all surgeries. Telemedicine, I think, is tremendous, and I think what's going on in telemedicine, particularly given some of the shortages you're seeing in physicians, particularly for primary care physicians, and the ability to leverage tertiary centers across a wide area, because the technologies are getting so good right now that you can be almost as if you're right there in the hospital or in the clinic somewhere in a very rural setting. I think that's a tremendous potential, and I think that's a great example of how technology is moving forward in a very positive way for medicine.
So obviously, we see a lot of tech headlines talking about these multi-billion-dollar exits and valuations, and that's not something we have seen as much of in digital health. And so my question for you guys is, what can companies do to become a billion-dollar company, or or do we even need them in the healthcare space?
Well, there is already $1 billion exit, right? So
Well, we don't have as many. We don't see as many in the digital.
So when
health
you
space.
figure it out, you let me know. We don't look at, obviously.
Do you think that's sorry.
Obviously, our venture part would like to see returns, and all the returns come back to Mayo, and it funds our research, and it funds our practice and our educational activities. But it's not about whether we got a $1 billion company or not. I think it's more about how is it strategic to Mayo, and how is it impacting the patient? Is it helping to make us more efficient? Is it taking some costs out of the system? Is it helping us engage with the patient better? And I don't know that you need the multi-billion-dollar exits. Now, maybe if you don't think the venture money's coming in, and there's a debate here about how much venture money's coming in the digital, they're going to want to see 5x, 6x, 7x returns. But when it's all said and done, my guess is people are going to do just fine, because it's a pretty short time to exit, and I don't know that you need to have the multi-billion-dollar company be successful.
I have to say, it's all about the $1 billion exits, right? There we go. So why it's important, right? First of all, if you look at it, venture capital companies are defined by their success, right? The first time I walked into Sequoia's boardroom, I was awed because I saw all the Bay Area companies, Cisco's, Oracle, Google's on the line, right? So if you work in a healthcare company, how many you can say is billions? So why it matters? It matters because when Facebook created their IPO, unleashed so much capital out there, so these capital becomes angel investment, become venture capital dollars. So I know all of us are struggling because there's no Facebook in healthcare, right? So the minute we have the healthcare, Facebook in the healthcare, or even Twitter's generate that wealth, that dollar trickles down, right? We're going to see more innovation. We're going to excite everybody. So to me, it's all about billions, and hopefully 10 billions, and hopefully my portfolio, each of them become $1 billion company.
Along those lines, we've kind of seen a significant growth in the consumerization of healthcare. So as the consumers are becoming more engaged and taking on more responsibility of their healthcare, the line between a patient and a consumer is blurring. So how do you guys see the role of a patient versus a consumer, and how do you imagine that changing over time, and who's paying for healthcare?
Yeah, it's a good question on the who's paying for healthcare. Ultimately, the consumer will probably be paying for healthcare if it's considered the consumer and not the patient. And I do think there is a little bit of a blurring that's going on. Patients are definitely becoming more empowered. They're more active in terms of seeking out information and trying to understand what the issues are before they even walk into a physician's office. So I do think that the blurring will continue. I think it'll probably continue more towards the consumer model. We ourselves really haven't quite figured out the consumer engagement yet. I don't know that people are that interested in engaging with a health system if you're not sick. To the extent that it's going to become more important for people from their financial standpoint, to be well and to be incented to be well, then maybe they'll want to engage with health systems earlier than they do now.
Yeah, I think certainly digital health helps the patient a lot. Right? Everybody going to the hospital, you probably have done your Google search, you have done your WebMD, right? So that's obviously consumer wants that. They want a better care, they want to have more information, but also, your employers become the consumer as well, right? Because they're under the pressure to contain the escalation costs. So hence, they shift more responsibility to you, and the government too, right? So you read the headline that Social Security is going to go bankrupt, whatnot. So I think the entire system is going to have to face the reality. We just spend too much money. We got too little outcomes. So I think everybody's going to become a consumer, and whatever we're doing here is enabling everybody to be more educated.
Do you think wearables are going to play a role in helping bend that cost curve?
I do, but I also want to talk about I actually missed the debate of wearable yesterday, so fortunately I was in another conference. But wearable is being such fascinating area, right? I think there's lots of talks about wearables, but I want to introduce a new concept because everything is going to happen, right? Everybody's waiting for Apple to launch that magic smartwatch everybody's going to buy, everybody's going to wear a white device in San Francisco and beyond. But I'll challenge you. I'm going to introduce you a new index following the Rock Health Index, which Malay put it together. I don't know how many people have seen that. It's a very interesting. Took all the digital health company together and look at a stock performance and see how the overall industry is doing. But I want to introduce you a new index to gauging the health of wearables, what I call EWI. So what's EWI? eBay Wearable Index. So that means So wear me for a second. Basically, if you look at M-box wearable devices, you go to eBay, right? I'm pretty sure you find that many of them are selling at 50% or lower. So what does that tell you? People don't want it. If you can start to find products are selling 20% off, maybe even selling list the price, then that's what's starting to see things happen. So I would challenge that. Let's measure that and see how that does with all the devices about to come into the market.
Yeah, and to me, I'm just curious to see how it plays out in terms of compliance and people staying with it, and then really trying to understand what the standards are going to be. I mean, really, not that we need federal standards, but what are the standards that people would want from a healthcare perspective for the wearables? What information do they want? I think one area that we just can't overlook is this concept of data overload. More information is not necessarily better. I think when you get to a point where you can't process it, it's not helping anybody. So is it useful information? Is it the type of information that a physician really truly needs to be able to make a good clinical decision?
So do you think that demand is going to be driven from the physician or from the consumer?
I think it's going to be a little bit of both. I mean, obviously, if the physician doesn't want to adopt it, it's going to be a challenge. It may be forced upon the physician by a payer, but it'll be a challenge. So I think the physicians are going to have a say in what they're really looking for. And I think their ultimate client is the patient, and if the patient really is demanding that this is what happens, then you're going to have that pressure coming back the other way. Ultimately, it's going to have to be a little bit of a give and take. There's going to have to be some studies done. There's going to have to be some reality put into it, that people truly understand what it is that they want from these wearables that are going to help them in making clinical decisions.
So we have a few minutes before we open up for Q&A, so I thought we could end with a nice little personal story from you guys. What's the most memorable pitch you've ever gotten, good or bad?
Yeah, so again, back to the wearables, I always asking people, actually this will be more a story from the others, I always ask people, why are you wearing that device, right? So obviously wearing it because, I want to stay healthy, and as an investor, I want to promote my company. And but one day I walk into the company, I saw one of the employees wearing a device. She's, stylish, female, executive, and wearing this device. Obviously doesn't really matches with her ensemble. So I said, what's your motivation in buying this device? And she goes, well, I bought only two, and one for my mom, lives in somewhere Rochester and East, and she's living by herself, and one for herself. And what they do is she's asking mom to be on the leaderboard so she can track how active her mom is. As that single indicator, she can have a very engaged discussion with the mom, living alone, thousands of miles away. So that, to me, is a very powerful story.
Some of the best little pitches I've seen, frankly, are from some of the Rock Health companies. KitCheck was a great pitch. I really enjoyed talking with them, and we're still talking to them about whether or not that's something we could use in Mayo. But to me, it's seeing the young entrepreneur who gets what's going on, who's fully invested in what they're doing. That's just it's so much fun to see that and see that energy, and hopefully see it work out. It's not going to always work out with us, but it may work out with somebody else. And so to me, those are the things that kind of get my juices flowing.
What made KitCheck's pitch so great?
To me, it was just when I looked at it and saw it, I said, this is a layup. I mean, it just seems to be a cost saver. There seems to be a nice return. It seems that they were solving the problems that they needed to solve from a technical standpoint. I really like what they were doing.
Great. So we're going to jump into the Q&A from the audience. The first question that has the most number of upvotes is for Jim. So would Apple and Mayo's relationship change the digital health landscape?
It remains to be seen. I don't know a lot of the details, frankly, myself about the Apple-Mayo relationship. So I, like you, are waiting to see what happens and where it goes. I do like a fairly large brand in medicine and a fairly large brand in the IT space, both, I think, and I hope, known for innovation, getting together, I think good things will come from that.
Jack, do you have a view on how it could potentially change the landscape
Apple
and Mayo's partnership?
Well, I'm a third party, so I'm not in a position to comment on that.
This next question is digital or otherwise, what's the biggest innovation you've seen in healthcare?
In digital health?
Digital or otherwise, so just anything in healthcare.
I would say the things, obviously, the entire digital health has been a huge innovation, but I also mentioned it's been going on a few years, right? So everybody kind of understand what's going on and how do you take it forward. So I would say the single most exciting things, which is correlated to the investment we just made, right? It's a company in genomics. So the people in the Valley understand the Moore's laws every 18 months, the cost performance curve. So if you look at it, the NG, next generation sequencing machine, which is outperforms that Moore's law, right? What means that the sequencing is going to be $1,000 and below. The ramification, that's huge. Because now, just like wearables, adds an entire new dimension to the understanding how one behaves to certain treatment. And even people actually go beyond. That one guy actually showed up in my office. He goes, guess what? If I were to be able to do all the sequencing, I can find out a certain traits embedded in your DNA. For example, your pension buying a sports car versus a family car. So to me, that again, joking aside, I think the genomics is going to have a huge impact to what we know and how we practice medicine going forward.
I would agree 100%. I think genomics is incredible what's going on there. Stepping outside of that area, I think one of the biggest innovations that I can remember is statins, frankly. I think it's going to significantly decrease the incidence of cardiovascular disease. And I think if they could, they'd put it in the water just like fluoride. It's pretty amazing what those drugs can do.
So Mayo Clinic's obviously one of the most innovative providers out there. And so why aren't we seeing any more Mayo Clinics out there? Why is digital so strategic for Mayo, and how come the others are lagging?
Well, I won't say that the others are lagging. I don't know. And my guess is that there are others who are probably ahead of us. And it's not like we have any special sauce or secret sauce or anything like that. It's just, I think people see the potential benefit for digital health. And I think that we really, truly want to figure out a way to engage with our patients, engage with them more meaningfully, and have a way for us to become more efficient. And it just, that you point right to digital health when you're trying to accomplish those goals.
What is missing in digital health today? In 2015, what pitch or product do you want to see under development that will help move things forward?
That's a big question. It happens at every single angle, right? So I can't think about, anything that we do now today it's making a meaningful impact. So again, I think if I were to go back, I think the magic of the wearables, it's going to hold a big promise. Because I have to say again, if you look at the wearable today, it's basically wearables are built at the mercy of the cell phone industry, right? All the componentry used today is a cell phone. So remember the first Motorola phone came out? How big that was? That's what the wearable is today, because they were using mobile phone was using the PC components, and I think the wearable is using mobile phone components. As advanced as it is, it's not optimized. So what I see is we'll see a sea change when this new material, new processor, new battery came out, that wearables in the future truly become a wearable. And I think it's 2 years away from that.
To me, it's about probably data analysis. It's trying to figure out how to make sense of all the data that's out there right now, that's being acquired right now, and that could be acquired, and trying to figure out what makes the most sense for clinical decision making.
What are the most valuable data sources you've been seeing today?
I'm not the one to talk to on that one. It really, to me, that's where I'd have to defer to my physician colleagues, and they know better than I do what data is valuable to them when they're trying to make their decisions. An example I would give is Ambient Clinical Analytics is a company we formed. In fact, I think our CEO is out in the audience there, Al Burning, and he's also a member now of the Rock Health, the last class, I think.
Yeah.
And that was all about trying to say, if you're an ICU doc and you walk in, what information do you want? And we have studies, and others have shown studies, that when you implement an EMR, doctors actually become less efficient initially. because of the data overload. It just cognitively, they kind of freeze up. It's too much information. And so it's a fairly simple idea overall, but I think a powerful idea, and that is give the physician the information they need when they walk in as an ICU doc related to cardiac function, respiratory function, and potential for infection. And as things progress in a negative way, give more information that's important for making a decision, all the way down to you have to intervene. But it really significantly increases their ability to interact effectively with the patients, to see the patients, and to be, in a better position. There was an interesting cartoon. I don't know where it was, so I can't attribute credit to it, but it was someone else's cartoon, and it was a kid basically trying to say what it looked like to be in a hospital room with a physician, and the physician is on the computer with the back to the patient. I mean, that's kind of where it's at right now, and I think what we have to do is we have to turn it around so that the information, the relevant information, is at your fingertips, and you have the ability to go deep at any point in time, but keep it at a high level so that you can function appropriately and effectively and efficiently.
How do you guys evaluate both the financial and social impact of potential healthcare investments?
Financial and social impact?
Yeah, so I guess how would you weigh the two?
I mean, what we look at from our perspectives, we look at, is it good for patients? There's a component to it of, is it going to take, cost out of the system? So an example of one that hit both for us was physician software systems. And it was all about how you manage people who are on drugs to manage anemia when you're on dialysis. And it used to be dialysis was reimbursed on the drug. And so people used to get a one-size-fits-all drug. So if I walked in the clinic, I'd get the same dose that she would get, which is crazy and ridiculous. And so we always looked at it from a patient perspective and tried to figure out how do you tailor the dosage. And then the reimbursement model changed from this, reimbursement on the drug to a bundled payment. And the minute that happened, everyone tried to figure out how they manage the drugs more effectively. And this algorithm basically helps them do that. And so from our perspective, there's an example, good for patients, good from a cost perspective, and a company that we think could be very successful.
I couldn't agree more. In fact, I have a similar example to share where I think how do we have economic impact as well as the social impact. For example, diabetes, right? It's talked about commonly, the compliance is bad. Diabetes, insulin-dependent diabetes are required oftentimes to prick your finger multiple times and inject insulin accordingly. But statistically, basically says only 30% of people or 40% are to that regimen. And yet, the drug companies are obviously sending the strips to you, right? Most of the strips they end up in the black market and dumpsters, which is not good for everybody. So now with the digital health, this is the first time we can make it accountable. How many strips you use and the frequency you use, we know exactly. So the government is actually, if you work in the industry, you find out the CMS is pushing down the reimbursement of the strips because they sense there's lots of waste. So instead of paying directionally $25 per viral, they said I'm going to pay $12. To me, there is a value to that. Why skirting around? Why says how many virals? Why don't we just change the model to dollar per test, right? So keep everybody honest and keep everybody on the same objective. So I think that's what digital health has an opportunity to taking all those efficiencies away and make it more transparent and make it more actionable.
One of the questions was, do you see proof of digital health occurring today? Or what has been the effectiveness, or have there been any outcomes or results?
Well, I do, and I would put ambient in the digital health realm. I guess it all depends on how you define digital health. I put physician software systems in that. I'd put AssureRx, another company that we have. That one deals with understanding someone's genetic makeup before you give them drugs so that you can understand if the mutations are going to adversely affect them. I think all those are having significant effect, and those are just 3 examples among multiple examples that I think are out there.
And if you look at a single most interesting evidence out there, hardcore evidence, is this company called WellDoc. WellDoc is basically an application, and yet they get reimbursed, right? So here's a piece of software, which is traditional reimbursements are used to reimburse your devices and drugs or whatnot. So obviously they have gone through the hurdle. They have demonstrated the efficacy of that piece of software, and they were getting reimbursed by the payers. So that's one example.
This question's for Jim. How do you vet investments that improve health and lower costs but cannibalize hospital admissions?
Well, people probably won't believe this, but I think one of our physicians, I want to say it's Dr. Montori, wrote a story about, or even a novel about how not to be my patient. So I think at the end of the day, we don't look at it to say, is it going to cannibalize admissions or not? If we put ourselves out of business, we put ourselves out of business. I know that's hard to believe, but it really is the way we look at things. We're not trying to look at it from the perspective of maximizing the revenue per se. It's about trying to drive good technologies that are going to help patients. And I think the way this all evolves is there's always going to be a need for tertiary health care. There's always going to be that need, and that's what we do best. And so from our perspective, we tell people how we do things. We don't have any problem with that. We'll publish it, we'll even train them, and we'll let them go out somewhere else. That's all right. We'd like to see the knowledge be diffused and the knowledge be disseminated. And so from our perspective, if we have technology that ultimately ends up cannibalizing admissions, that's fine. That's okay. If it's what's best for patients, that's okay by us. I know that might be hard for some people to believe, but that's the way we operate.
Great. And this is the last question. So ideas that appeal to physicians are what will help their practice now, and ideas that appeal to the VCs focus on the potential ideas in the future. So example they gave is genomics. So do you guys envision these two overlapping?
Well, certainly many types of investors out there. There are investors believe the thesis that, long-term views, right? When I define long-term view in the venture world, it'll be 7 years and 10 years. They're willing to finance a company like that. And there are investors out there. But most of the investors in the Silicon Valley are looking for how do you, generate, predictable business revenues in the 2 to 3 years. So I think that's pretty much aligned in the sense that most of the companies are measured success by adoptions, by revenues, not necessarily just on the vision itself. So I would say, whatever the things that we do, it'll directly go into be impact to how we practice medicine right away. When I say right away, in the 2 to 3 years time horizon.
I think that's exactly right. I would agree.
Well, great. Thank you guys so much for joining us for this panel, and I hope you guys found that helpful.
Thank you so much.